Hi, Stephanie Erickson, social worker here. I work with seniors and families and the professionals who serve them around issues of aging. Today's edition of Ask the Expert is a question that comes from Daniel in Vancouver, and he writes, "How do I know if my memory loss is normal or if I have Alzheimer's disease? My father suffered from it and I'm worried it's happening to me now." First off, Daniel, take a breath and actually a few deep breaths. Memory loss does not necessarily mean that you have Alzheimer's disease. As a mother, I can certainly tell you that when I am overly tired or stressed with managing my responsibilities, I too suffer from memory loss. That doesn't mean that I have Alzheimer's disease. So lots of things can contribute to memory loss, medical issues, such as, thyroid problems or other medical conditions, medication side effects, medication interactions, stress, fatigue. So it doesn't necessarily mean that you have Alzheimer's disease, even if there is a family history. That being said, I would say to start a log, and over the next few months, Daniel, why don't you start recording your symptoms? And you might want to categorize them. So you might want to record some short-term memory problems that you find you're having, write down the days and the times, and any other situations that might have contributed to that event when you had some short-term memory loss. Same thing with long-term memory. Also, if you're disoriented at any moment, when you're in familiar surroundings, jot that down. If you find that you're having any language problems, looking for your words or processing information that's being given to you either by reading or verbally by somebody else, or perhaps difficulty understanding complex content such as in financial documents, just start jotting all of these things down, and in a few months bring them to your physician, and he or she can certainly conduct some additional tests to see if in fact you do have a cognitive disorder. It's really important, although very scary, but important to address this now. The sooner the better, because there are some medications that can be used to help to minimize some of those symptoms that you're experiencing and to delay the onset or the progression of the illness. If anyone else has any questions related to aging, you can email me at ericksonresource.com under Ask the Expert, and I would be happy to answer. Bye-bye.